The next presentation will be by Taylor Johnson, characterization of genomic DNA in somatic and germline tissues that contribute to hypoplastic left heart syndrome. Dr. Biddle was the PI.
Yes, hi, I am student Dr. Johnson, and I was able to work with my mentor, Dr. Biddle, this summer and really for the past year to study the characterization of genomic DNA in somatic and germline tissues that contribute to hypoplastic left heart syndrome. Okay, so hypoplastic left heart syndrome is a congenital heart defect that is associated with the malformation or dysfunction of the heart's left ventricle. It is difficult to treat in that most of these infants will require multiple surgeries, and they will experience poor qualities of life going forward and relatively short lifespans as well. So a little bit about the anatomy and physiology of hypoplastic left heart syndrome. So on the left here, I do show a normally developed heart with two, adequate ventricles. On the right here, I show abnormally left ventricle, and it's abnormal in the way that it's not fully developed. And as you can imagine, this creates a lot of issues for these infants, meaning that systemic perfusion is not happening adequately, and oxygenated blood is unable to reach the rest of the body. So a little bit about my methodology. So atrial septal and blood samples from infants with hypoplastic left heart syndrome were obtained. So using bioinformatic tools, in-depth analyses were performed. So from this, a table I will show on the next slide, we were able to show impacted somatic variants that were found in all infants and were isolated based on their associations with various cardiac pathologies. In addition, we were able to isolate a pathological network created that included these somatic variants and were also related to congenital heart defects, development of the heart. So on to results. I do want to mention that the results I presented this past summer were preliminary. So this has been really interesting in the way that these results specifically were the culmination of about 6 to 8 months of research just this second year. Going forward, this is a table showing common somatic variants in all infants that were found only in their atrial septal tissues and that were related to heart development. So again, variants were somatic and were unique in the way that they were found in all of infants, only in the heart and not in the blood. So I emphasized a few of them here. For example, GPC3 showed alterations, and those are associated with cardiac defects and severe cardiac arrhythmias, as well as LRRC37A3, normally associated with protein binding, but this was a somatic variant found in all 4 infants in the heart that is typically related to atrial septal defects, ventricular septal defects, and persistent ductus arteriosus. I also highlighted here NBPF10, also associated normally with protein binding that has been linked to cardiac defects associated with microcephaly. SHRM3 associated with actin binding normally that has been linked to atrial septal defects, and SNORA31 associated with RNA processing usually, but that has been associated with tricuspid atresia as well. So again, these were all somatic variants in the infants' atrial septal tissue only, and in all 4 infants. Now this is a network, impacted network of essential to cardiac development and among somatic variants. So here I highlighted SBEG and YAP1 somatic variants. These seem to have the most connections in the pathway between infants, and they seem to by far have the most abnormalities associated with them. For example, apoptosis of cardiomyocytes is just one of them, but a range of pathologies related to the abnormal cardiac development. And I do want to emphasize here also that each infant did come with his or her own set of unique variants. So the variants in this pathway specifically were not all the same for each one, but it's interesting in that the overall damage appears to have been similar. So the unique variants themselves may not have been the same, but they do align in the same pathway. So just moving on to discussion now. So again, the analysis of the atrial septal and blood samples allowed us to really differentiate somatic and germline mutations contributing to hypoplastic left heart syndrome, which hasn't really been studied before. So several of those shared somatic variants among the infants were discovered, and those did exhibit associations with abnormal cardiac and organ development. Along with the pathological network I did show on the previous slide, which indicated that somatic variants unique to each infant may have caused significant pathway distortion, leading to abnormal heart development. And then lastly, further research is needed to explore analysis of genomic DNA in somatic tissues with a larger sample size, as we only did have 4 infants. So that needs to happen going forward. Last, just a thank you to the KCU faculty, as well as the Children's Mercy Hospital team. Here's my works cited, and I'm happy to answer any questions.